Diabetes is often thought of just a blood sugar problem, but its impact goes much deeper. One of the most serious and lesser known risks for people with diabetes is the effect it can have on heart and blood vessels. In fact, diabetes significantly increases the risk of heart diseases, strokes, and other cardiovascular complications. High blood sugar over time can damage arteries, raise blood pressure, and lead to serious health challenges if not managed properly. So, in this session, Dr. Anish will explore how diabetes and heart health are deeply connected, what early signs to look out for, and most importantly, how to take steps to protect your heart while managing your diabetes effectively. Dr. Anish is highly respected consultant endocrinologist, holds a DM in endocrinology and has been at forefront of treating complex hormonal and metabolic conditions with a special focus on diabetes and its long-term complications including cardiovascular risk. With his deep clinical knowledge and evidence based approach, Dr. Kar is dedicated to helping patients understand the broader impact of diabetes on overall health, especially the heart, and empowering them with the right tools to take control of their conditions. So, in today's session, he will be help us shed light on this crucial intersection between diabetes and cardiovascular health on this condition. So, before moving further, doctor, would you like to add something from your end?
So, good evening, everyone, to all our listeners listening in. Thank you, madam, for that kind introduction. So, yeah, as we will be talking about diabetes mellitus and cardiovascular disease, so we have to keep in mind that one of the most important causes and possibly the most common cause of death because of diabetes mellitus is not just because of the sugars, but heart disease, which is the focal point or the fulcrum of our topic today. So, addressing cardiovascular disease, why it happens, how diabetes kind of accelerates or makes the progression of heart disease in a patient faster, and how we can manage a patient of diabetes mellitus having heart disease, managing both the sugar component as well as the heart component and the various factors related to it. So all of that needs to be kept in mind. So on that note, we will start the question answer session then.
Yes, definitely, doctor. So, my first question is how exactly does diabetes increase the risk of cardiovascular disease like heart attacks or strokes?
So, diabetes mellitus is a condition of the body where you have elevated sugars. Now, how does that translate into causing more of heart disease? So, you have to keep in mind that sugar in excess is a bad thing for the body. The our our human body, which evolved from like a hunter gatherer lifestyle in the earliest days of mankind, is not suited to having extra food, extra calories being put into the body and then sitting with it sedentarily, because then the body does not know what to do with the excess calories or the excess sugars. So to kind of sum it up, possibly it shunts out those excess calories, those excess sugars into fats and other bad inflammatory mediators, as we call it. And that kind of sticks to the heart vessels, sticks to the insides of the heart, makes the blood more sticky, more prone to forming clots. And if anything is more prone to forming clots inside a pipe, then it will clot, just as the blood vessels are
Yes.
supplying the heart. And so you will end up with having a kind of a heart attack, where the blood which is supposed to reach that part of the tissue which is pumping doesn't reach it. And so there's a demand supply mismatch, and you end up with ischemia and thereafter failure of the heart. So that point needs to be kept in mind. You are ultimately dealing with the common soil hypothesis, that is inflammation, where diabetes mellitus contributes in a major way, both as a cause as well as an effect.
Yes. Thank you, doctor, for telling and sharing this information. So, doctor, are there any early warning signs that people with diabetes should watch out for and in terms of their heart health?
So, in terms of your heart health, I think the most important thing, apart from early warning signs, is going to your doctor for your annual or maybe semi annual 6 monthly checkups. If you ask me how the patient can detect he's having on a heart disease, well, by the time the symptoms usually set in, the progression of heart disease has gotten quite severe. So for we say in our studies that for someone to have ischemic symptoms or anginal symptoms, that is symptoms of chest pain and other things, where there is exertional shortness of breath brought about by undue exercise, like walking more than a flight of stairs, walking faster than your peers. That kind of thing is brought about when the coronary, that is the blood vessels supplying the heart, are almost narrowed by a percentage of maybe 50 to 60% or more. So it is not so easy to detect heart disease by the patient early on, but it is easy at that point of time to prevent heart disease from setting in by going into your doctor, getting your blood reports done, including getting your blood pressures checked, your lipids checked, your sugars checked, and keeping them in control, along with other particular heart disease related modalities that I think we will discuss later on, such as
Yes.
12 lead ECG or a 2D echocardiography. So those things can be kept in mind. And of course, if you are having more than the usual shortness of breath, if you're kind of you are having if you have labored breathing, if you have a chest discomfort or the feeling of something sitting on your chest, that is a very atypical sign of angina or chest pain. And diabetes mellitus patients, or patients with diabetes mellitus rather, are more prone to have these atypical symptoms like an epigastric discomfort or a mild nausea or kind of premonitory symptoms, which are not the traditional symptoms of the kind of chest pain radiating to the heart or the left upper jaw that other patients without diabetes would usually have. And of course, if they are short of breath, they will have like cough, recalcitrant cough. They could have enlargement of the vessels in their neck. They will have swelling of the feet, which could be brought on by other renal associated or kidney associated symptoms in diabetes as well. So these things also should be kept in mind.
Okay. So, doctor, our audience also want to know that can good blood sugar control alone reduce the risk of heart complications, or are there any additional precautions needed?
So, with much of the research that has got into it and with medications have got into it, it has been clearly shown that just controlling your sugars is not sufficient to kind of stave off heart disease, especially once it has set in. Yes, if you control your sugars, you can prevent further progression, but usually in most cases you will need other medications, you will need directed screenings to treat that heart disease. So to cut it short, adequate glycemic alone control alone is not sufficient to control heart disease.
Okay. So, doctor, how do lifestyle factors like diet, or it could be exercise, or also stress management, plays a role in protecting both blood sugar and heart health?
Okay, a very nice, pertinent question, I think, for all of us and especially for the general public. So, three things
Yes.
that you asked: one was the diet, one is the lifestyle measures, including exercise, and one is definitely in today in our busy 21st century beyond environment. We need to keep up with how fast our life has become with all the extraneous environmental influences, be it in forms of pollution, be it in the processed foods that we are taking, and we are not taking as much of home cooked food or getting the adequate exercise or even rest. So all those points will need to be addressed both in terms of heart disease as well as cardiovascular health. First, I will talk about something diet. We Indians love to eat, but at the same time, diet low in salt, a diet low in processed foods, a diet with reduced amounts of saturated fats, and low in plant sterols. These are all risk factors which can contribute to an adverse cardiac health. So you need to lower your sodium content, lower your processed food content, take more of home cooked food, cut down on oils, cut down on saturated fats. I think we have more of an awareness regarding the use of seed oils and how it is impacting our health and heart health as well, especially in India. So that point also needs to be kept in mind. And we have a kind of a dash diet approach, that is a dietary approach to stop hypertension, or a Mediterranean diet where you like kind of increase the amount of maybe fresh leafy vegetables outside. In maybe the Mediterranean, where the dash diet actually came in, or Mediterranean diet came in, they use olives. We don't grow olives in our country, but I think we have safer alternatives to the cooking oils that we use commonly. That could be, oils in saturated fats. So replace it with oils containing more unsaturated fats and omega-3 fatty acids. So all those points need to be kept in mind. Exercise, at least 30 to 45 minutes of exercise amounting to an adequate amount of metabolic equivalence. So that is not just ambling around your neighborhood, appreciating the environment, but doing a brisk walk, working up a sweat is usually every day for 30 to 45 minutes sufficient to get that added benefit of exercise as far as reducing the risk of progression of heart disease or protecting against the adverse effects of heart disease is concerned. Also, you may go in for other activities like cycling, like swimming, especially in the summer months. These are all very important. But just as we talk about the aerobic activities, there's also the need of resistance training. That also is important, because a major player in diabetes is insulin resistance. So if you do kind of resistance exercises, it has been shown to not only improve balance and muscle health, but also improve insulin resistance and improve the effectiveness of the insulin already being produced in the body, which can help bring down sugars. So that also needs to be kept in mind as far as exercise is concerned in terms of blood sugars and cardiac health. And of course, reducing stress. Today, in our fast paced environment, working 9 to 5 jobs or even 9 to 9 jobs, or working from home, or having night shifts, especially with desk jobs, even us doctors are not protected from it. So, placing out a dedicated time to have with family outside your professional domains, where you can invest in yourself, be it in terms of exercise, be it in terms of yoga, be it in terms of pranayam, where you can, kind of de stress and take off the day's edge after you come back from work, is very important in reducing the entire stress. We know cortisol is called the stress hormone. Many a times we have heard that patients are stressing out, or the doctors say that you're taking so much stress that is increasing your blood pressure or your sugars. It has now been brought out with research that a mild amount of cortisol actually contributes to increasing sugar levels, hypercortisolemia, and now you have trials which are trying to address that. So that point, reducing stress is so important for reducing not only blood sugars but also protecting heart health.
Thank you so much, doctor, for sharing this information, because I guess this is in our hand. Apart from medications, we can protect ourselves from the
Correct, correct. And
heart
definitely it
diseases
needs
and
to be kept in
disorders.
mind. But again, the exercise prescription, diet prescription, apart from maybe the exercise physiotherapist or the nutritionist or the dietitian, especially in far flung areas, the primary care physician or the secondary care physician should be an important person with whom you should discuss these points, especially if you have heart disease and diabetes.
So, doctor, as you were telling about some tests, so can you please tell us what are some key tests or screening that diabetic patients should regularly undergo to monitor their cardiovascular health?
So, if we talk about our patients with diabetes mellitus, they should be having an annual heart checkup, or if you want to do it more intensively, then maybe every 6 months. And for a patient with diabetes mellitus coming into our clinics, checking a blood glucose, a random blood glucose, if you are not timing it to a fasting or pp level, is important. Checking hba1cs is also important. Checking a blood pressure, detecting hypertension. Many a times we also see in our offices, detecting blood pressure is so important. Many a times the first time hypertension is detected at our offices. So doing it in the proper manner with an average of at least two or more readings, so that the systolic blood pressure comes up over 130 or diastolic blood pressure comes up over 80, after excluding extraneous environments like maybe coming in after a hurried walk in the warm environment, or taking coffee, sugar, or other things, or maybe smoking just before coming into the clinic. All those things need to be kept in mind. So checking the blood pressure is also important. Checking markers of body fat content, including maybe waist circumference, basically. And as we speak more about obesity and the way anti-obesity medications are coming into India for treatment, so that also needs to be kept in mind, because that impacts both diabetes as well as heart health. And then after that, going in for, at least if not done in the last year or in the last 6 months, a basic 12 lead electrocardiogram to check for the rhythm abnormalities or even structural abnormalities, and thus being informed going ahead with a two-dimensional echocardiography is also important, with or without a Doppler scan. But before that, also doctors should also be auscultating their patients for any overt signs of maybe heart failure or any valvular abnormalities or any rhythm abnormalities, and then order these tests. So it's a very kind of a holistic manner where all these tests should be done to a minimum.
Yes. So, doctor, as hypertension comes in the picture now in the discussion, so I want to ask you that what is the link between high blood pressure, the hypertension, and diabetes when it comes to a heart disease risk?
So, in most of the epidemiologic studies and even the drug trials that have been done till now in the real world setting, the most common comorbidity of patients with diabetes mellitus is hypertension. So, it kind of goes hand in hand. If you have diabetes, you will have hypertension. So, like I was saying, that diabetes mellitus basically means you have a lot of excess sugars being converted into bad things, inflammatory mediators. They kind of go and affect your blood vessels. They kind of the elasticity gets lost, the blood vessels stiffen. So you end up getting, if a pipe stiffens with the same amount of volume in that pipe, the blood pressure will start rising up for a constrained volume. So that needs to be kept in mind. The heart starts to stiffen. We have something called heart failure with preserved ejection fraction, which is very common in a diabetic patient with hypertension. There's not overt loss of the pumping function, but the heart just stiffens and fails to expand with all the blood that it gets from all parts of the body. So heart failure with preserved ejection fraction, that also becomes important. And then the hormonal milieu in diabetes also changes. You have increased activity of something called the renin angiotensin aldosterone system, for which we now have particular drugs directed also. That goes into a kind of a hyperactivity in a patient of diabetes mellitus. They are more prone to having sympathetic hyperactivity, a kind of a more of a exaggerated fight or flight response. So all those things, and then the insulin resistance, the inflammation at the level of the blood pressure mediators, they also play a role. So all these things kind of feed one into the other. It's kind of a vicious cycle. Diabetes and hypertension, the more the diabetes, the more it will feed into hypertension. So it's very crucial to address both these problems early on together at the same time.
Yes, definitely. So, doctor, as you were saying about the checkup and screening, so my question is leading to that only, that how often should someone with diabetes should visit a doctor to check their heart health? What should be the frequency of that person
So,
for
as we reiterated
checkups?
in our guidelines from the American Diabetes Associations and most other society guidelines, they're pretty consistent with it. For asymptomatic patients, annually or at least every 6 months. Then, depending on what your clinical examination comes up, or your ECG reports come up, or your echocardiography reports come up, it could be reduced to maybe every 4 monthly or every 3 monthly. And if they are immediate problems like shortness of breath with swollen feet, enlarged vessels in the neck, impending heart failure, that would require immediate urgent admission. So it kinds of deals with the kind of patient that is coming to us. Accordingly, you ask them about symptoms, you clinically examine them, you order investigations, and accordingly titrate the frequency of follow-up.
Okay, thank you, doctor. So, if someone already has a heart problem, so does having diabetes make the recovery more difficult or risky?
So, if you have a heart problem, say in terms of a coronary artery disease or maybe heart failure, then diabetes mellitus, it's not that it completely retards recovery from these conditions, but you have to treat that diabetes mellitus to get adequate results for these heart conditions as well. Yes, there could be certain issues, and this is especially important if the sugars are really uncontrolled, like maybe the operation for the heart surgery takes more time to heal, or you have multiple plaques or multiple blocks in multiple vessels of the heart at the same time, which is always not conducive for putting in stents, which would otherwise be very simply put for one clot in one specific vessel. They can have multi-vessel disease that increases the chances of requiring surgery as well. Then again, with diabetes patients, and especially if that same patient with diabetes is also a smoker, it increases the risk of having peripheral arterial disease, your leg cramps up after walking, or you have color changes, gangrenous changes in the foot, that is also kind of accelerated if you have diabetes. And something which we do not always assess or be able to assess in the Indian clinical setting is asking about things like erectile dysfunction or the sexual health, because that also is a kind of a marker towards cardiac health as well. That also needs to be kept in mind, and possibly something our patients should be asking their doctors.
Thank you so much, doctor, for sharing this information and everything in detail. So, lastly, is just do you have any message or tip for our audience on these particular conditions?
So, if there's a message or a tip that goes out from all of this, if you are going to take away something home, then that is, if you have diabetes, don't ignore it, don't overlook it, don't go by any kind of homemade or TV sold supplements or some things would suggest. Go by evidence, go to your doctor, get yourself checked up, ask for at least basic blood pressure screening, a basic blood sugar screening, at least get in ECG done and get those reports in, and follow up as the doctor advises you. If your doctor considers something to be abnormal or something which is not falling in line, usually in most cases it turns out to be kind of a serious thing later on. So don't fail to hear what your doctor is advising you. That would be my take home message.
Yes, thank you, doctor. Also, I guess the acceptance is a key for everything. Like, if you have any issue, you should accept that and go for the checkups to your
Absolutely. If you have a certain
doctors.
complication, so like if you have coronary artery disease, you have heart failure, you are already a patient of diabetes, definitely we also, as doctors, we work as a kind of a multidisciplinary approach, especially in today's healthcare setting. The diabetologist or the endocrinologist, the cardiologist, the GP or the primary care physician, the internist sitting at the front lines, then you might be having the CTVS surgeon, then the nephrologist looking in after complications of diabetic kidney disease, or maybe the neuropathy complications being looked after by the neurologist. They should all work together. We should all try to see how our advice is affecting the patient and listen to what the patient is telling us and try to reduce polypharmacy, because often at times we see that we are not very cognizant of the drug interactions of the various drugs that we are using. If you can combine two or three drugs into a single pill and still give the patient the same benefit, then that should always be encouraged, especially as our diabetes patients survive to older ages with our current therapies. Becomes more important.
Yes. So, as we conclude today's session on diabetes and cardiovascular health, a sincere thank to Dr. Anishkar for sharing his expert insights on such a vital topic. His guidance helped us to better understand the deep connection between the blood sugar and heart health and why managing both is a key to long term wellness. To our wonderful audience, thank you for tuning us. We hope this discussion has empowered you to take better care of your health, whether it's scheduling regular checkups or adopting a heart health lifestyle, or simply just being more aware about the things or signs your body may give you. So, stay connected with us for more sessions like this, featuring trusted experts and meaningful conversation. Until next time, take care of your heart, manage your blood sugar levels, and follow us on social media platforms for more such health related tips. Dr. Anishkar, once again, thank you so much for joining with us.
Thank you, Ms. Kurade. Thank you, Beyond Sugar. Thank you for the patient listening to everyone who's joining in. Have a good evening. Thank you.
Good evening.